Excellencies, Sir, distinguished guests, ladies and gentlemen, while upstanding, the Kenya Police Presidential Escort Band will lead us in the installation of the public seal of the Republic of Kenya as one of the enduring symbols of our sovereignty and statehood as set under the second schedule of the Constitution of Kenya. Your Excellency, Sir, permit me now to invite the Principal Secretary for Public Health and Professional Standards, Ms. Mary Mutembei, to lead us in a short word of prayer.
Let us pray. Father, we come before you this afternoon. We thank you, Father. We glorify your name. We thank you for our President, O God. We thank you for all the leaders. We thank you for the plan, Afya Nyumbani. And now, as we move into the implementation stage, Father, we pray that you grant us mercy, you grant us grace, you grant us the strength so that we can execute in the ways of the Lord. And in Jesus' name we pray. Amen.
We will now take our seats. Your Excellency, with your kind permission, Sir, I now invite the Chief of Staff and Head of Public Service, Mr. Felix Koskei, to make state invocation and thereafter progress the day's program. Welcome, sir.
Your Excellency, the President, Your Excellency, the Deputy President, the leadership of the National Assembly and the Senate, Cabinet Secretaries present, the Chairperson and members of the Council of Governors, the Chairperson and members of the National Assembly Departmental Committees on Health, the Chairperson and members of the Senate Standing Committee on Health, Principal Secretaries, representatives of our development partners, healthcare workers present, honored guests, distinguished ladies and gentlemen, good afternoon. Your Excellency, this state ceremony is convened pursuant to Article 115 of the Constitution for the presidential assent of 4 bills on universal health coverage that have been passed by Parliament. Sir, the 4 bills were processed through both houses of Parliament, with each house of Parliament originating 2 bills. The Senate originated the Primary Health Care Bill 2023 and the Facility Improvement Financing Bill 2023, while the National Assembly originated the Digital Health Bill 2023 and the Social Health Insurance Bill 2023. Sir, these 4 landmark bills represent our nation's most consequential step in our journey towards realizing universal health coverage. Collectively, they overhaul our current health system by establishing a framework that secures a healthier nation where no person is left behind. Your Excellency, with both parties, with both houses of Parliament having discharged their lawmaking mandate, Your Excellency, as the head of state and government, is most graciously invited to exercise your presidential prerogative as vested in you under Article 115 of the Constitution to assent to these 4 pieces of legislation into budgets, starting with the Senate bills and thereafter the National Assembly bills. Your Excellency, sorry. Sir, permit me now to invite the following esteemed state officials, alongside representatives of our healthcare workers and medical students, to witness Your Excellency ascending to the Primary Healthcare 2023 and the Facility Improvement Finance Bill 2023. His Excellency the President, the Deputy President, the Honorable Attorney General, the Cabinet Secretary for Health, the Speaker of the Senate, the Chairperson of the Council of Governors, if she is present, or a representative, the Deputy Leader of the Majority Party in the Senate, and the 6 discriminated health workers alongside the medical students. Your Excellency, sir, I now invite the Clerk of the Senate to convey the vellum copies of the 2 bills for Your Excellency's presidential assent.
伙伴，在4G、5G 国家骨干网等通讯网络。
Of course, connected to the digital superhighway, and at primary school they can be taught using this, where the teacher can use this to give new technologies. We have the digital board. On the remote side, there are students who will be able to interact with me. I will write a simple question here.
To be able to have a CT scan, the healthcare professional back at a health center in Elwak on how to treat their patients. It is this revolutionary interventions, Your Excellency, through a very participative process that began with the Ministry of Health, and I must commend the Ministry of Health for the very detailed and participatory approach they began almost a year ago when your administration came in power. To date, Honorable, Your Excellency, my apologies, I'm used to addressing the Honorable Speaker. Your Excellency, culminating to the assent of these 4 bills today. That participatory approach, Your Excellency, culminated in what has also now anchored a new way of working between the 2 houses of Parliament, and I'm glad to inform Your Excellency that the bicameral Parliament has worked very well together, both houses, the Senate and the National Assembly. And we saw the passage of these bills in both houses. The bills that originated from the National Assembly were passed in the Senate without a single amendment, and those that emanated from the Senate were passed in the National Assembly without a single amendment, through a process where the 2 houses, both committees of health in the 2 houses, were able to consult ahead of the passage of the bills and agreed on the nature and manner of amendments that they wanted passed, and they were done in each house. And Your Excellency, I believe this also lays a very firm foundation on better working systems and processes of the bicameral Parliament in our country. With those few remarks, Your Excellency, congratulations, and I do hope, Your Excellency, that you shall lead your administration in actualizing this dream of universal health coverage to the people of Kenya. Thank you, Excellency.
Your Excellency, permit me now to call the Leader of Majority from the Senate. I'm told he's not around. He'll be represented by the Chief Whip.
Mr. President, sir, all protocols established, it is my pleasure on behalf of the Senate, elected and nominated members of Parliament, to bring their greetings and to bring their congratulations to the President and all the stakeholders, including the families back home that will be partaking of this bill. Your Excellency, allow me, as I congratulate you, to also pass my congratulations to the leader of the minority in the Senate, because on this series of bills, it is an area where we agreed to agree on everything, including some of the amendments we eventually made. Allow me, Mr. President, to also thank members of the National Assembly because they accepted all the bills that originated from the Senate without any amendments. Mr. President, sir, allow me also to thank the Minister and her permanent secretaries for the support that they gave us when we were debating these bills. Finally, but not least, Your Excellency, let it be on record that where the Senate debated these bills from was actually where primary health is truly required. We did the debate from Lodwar, the headquarters of the county government of Lodwar. The county government of Turkana. We were well received by the governor plus the entire county assembly, and we owe them. Mr. President, sir, members of the Senate debated late into the night because they wanted to make this enterprise even better. Your Excellency, as a professional of medicine, I want to confirm that you are truly going to be remembered in this country for what you have done, because it is lack of primary health attention to the concerns of patients that eventually leads to the loss of unnecessary lives. Mr. President, the innovation of the digital health bill is going to save millions upon millions of Kenyans, because many mothers, some of them, have no idea what the doctor said 6 months ago when the child presented to them. And when they have to restart the story, they lose out on very important information. But with the digital innovation, this will no longer be necessary. And remembering that some of our mothers do not have the standard of education required, and Mr. President, remembering that some of the mothers also live with disabilities, including the disability of inability to talk, the disability of inability to hear, Mr. President, this indeed is the time for this legislation. I thank you and I congratulate you. Uriomno.
Your Excellency, in the development of the bills, we worked with very many development partners. Those who supported us in drafting, supported us in developing the standards that eventually went into the bills. There are many of them that I cannot be able to mention each one of them. But on behalf of all of them, I would like to invite the WHO country representative, Dr. Abduramin Diallo, to come and make a few remarks.
Your Excellency, Mr. President, Your Excellency, the Deputy President, please allow me to stand on the protocol already established. It is a great honor for me to be here today representing WHO and representing all the development partners to witness this historical moment of signing these very important health bills. Mr. President, little less than 10 years ago, I was called back in my country of origin, Guinea, to serve as Minister of Health to help bring to an end the worst disease outbreak in that sub-region of West Africa, the Ebola disease outbreak that started in Guinea, spread to Liberia and Sierra Leone. It was very severe. It was bad simply because the health system was not resilient in all its components. In terms of surveillance, the surveillance system was not ready at all. And we all know the importance of community-based surveillance, the ability to detect unusual events happening within communities, recording that, and transmitting that. The infrastructure was not appropriate. Human resources were not adequate in terms of quality and quantity. Diagnostics was not where it needed to be. In fact, the diagnosis was confirmed in Lyon, in France, not even in Guinea, not even in Africa. The supply chain was not where it needed to be. Your Excellency, I'm bringing those up simply to say that by signing these bills today, you enable the health system in Kenya to be resilient and ready for those challenges. It was bad. 33 out of our 38 districts were hit with 67% mortality rate. We lost 115 healthcare workers to Ebola. Again, you enable the health system today to be resilient and ready for such challenges. And I would like to congratulate you on behalf of all partners. Your Excellency, I'm not going to deliver a speech. I just want to say one simple word about the fact that you bringing health to the communities, wherever they are, whoever they are, ensuring equity here and leaving no one behind. And those bills are in alignment with the Sustainable Development Goals, specifically SDG 3. And in terms of process, you've made it very clear consistently that health is a priority of your political agenda. And that message has consistently been conveyed by the Cabinet Secretary, Susan Nakumicha, her principal secretaries, the Director General, and technical services. In terms of inclusion, us as development partners were always invited, we were consulted, we were at the table, so we were part and piece of this whole process, and we would like to thank your services, the department, for that inclusion, for that great partnership. Beyond that, we also witnessed that other departments were invited. Every time the Ministry of Health is organizing an event, other departments are invited. That ensures synergy, complementarity, and cohesion in the governmental action because health is at the center of development. So I would like, on behalf of WHO and once again all development partners, to congratulate you and assure you that we will be by your side. You ring, we will answer. Thank you very much.
Your Excellency, the implementation of primary health care lies in the hands of the county governments. Permit me to invite the Chair of the Council of Governors. I'm aware that she's not in, but she'll be ably represented by the Chair of the Health Committee in the Council of Governors, Honorable Mudomi Njuki, the Governor of Tharaka Nithi County.
Your Excellency, the President of the Republic of Kenya, the Deputy President, and all protocols observed, ladies and gentlemen, Your Excellency, allow me first, before I make my remarks, to confirm to you that the Council of Governors is fully represented here, and you are part and parcel of this journey. I am accompanied by the Governor for Kakamega, who is also Chair for Finance. We are also accompanied by the Governor of Narok and the CUG Secretariat who are within us. Your Excellency, also allow me to thank you on behalf of the Council of Governors. You know, we are not used to bills being signed in broad daylight in public, in glare of the public like this. We don't want to say the word, mostly they were being signed. And that is why you saw that when I came here first, I walked back and I went to the bill because we are not used to these things. Apologies for that. Your Excellency, when we met in Naivasha for the summit, you are very clear in your mind to the governors that UHC must be implemented around this time. And this time round we should not fail because it has failed 3 times. And Your Excellency, today we are happy to be here today to witness and congratulate you for the record speed at which you have achieved what we thought would be achieved in several years, has been achieved in just several months. On 17th of September, we were convened by the Cabinet Secretary for Health as Council of Governors to be taken through what would be contained in the 4 bills. And I confirm, and you're aware, that we raised a few issues. There was a bit of noise, but that is normal, Your Excellency, because when you're constructing a house, at the beginning, there's usually a lot of noise of several tools being used. But when it comes to the launching of the complete projects, it is usually merry and happiness, like you're witnessing today. I want to confirm that we formed a technical committee composed of both the Minister of Health and Council of Governors that looked at all the issues. And I'm here today to confirm on behalf of the Council of Governors that 95% of the issues were addressed, and therefore we are contented because 100% would be a bit abnormal. Your Excellency, of the 4 bills, we have no issues completely with the 2 bills, and that is the digital health bill and the primary care health bill. The other 2 bills, we will not say exactly we have issues. We only ask that we, in the state they are in at the moment, they may not be implementable, but the solution would be to have regulations made in the shortest time possible so that we can make them implementable in a better state. And I'm sure with all the speakers here and the leader of majorities, that is going to be achievable within the shortest time possible. I want to thank you on behalf of the Council of Governors for making it possible for our wananchi who have been dying under the burden of the bills that are usually in every village in Kenya, raising money for bills, for medical bills. It is now going to be a thing of the past because the social health insurance bill has ensured that we'll have more contribution by all Kenyans, because I don't see, even in the village, one who will not be willing to contribute 300 shillings just to secure the future of the family. We want to thank you most sincerely for that. And lastly, like the Chief Whip has put, one of the biggest killers or health hazards in Kenya is not really mistreatment, but it's usually misdiagnosis. And that happens because in our health space, at the primary level, right at the village, all patients normally have a piece of paper they normally call kitabu hospitali. It is usually very expensive in the village. They can't afford a whole exercise book. So they usually cut it into half or quarter, and they carry that as a medical record, and it's kept like a very valuable document. But Your Excellency, if people can lose IDs and passports, what is a medical record? So people always find their way back to the hospitals without that record. You're in a different county, you are treated in another different county, you have no records, and when you give the story again, you may be given the same drugs you were given 10 years ago, which failed. And as a patient, you may not be able to know. With the digital health bill, it will not be possible for the doctor treating a patient in a different county to be able to access those medical records from another county and do the right diagnosis. That will save a lot of lives, and that is what the future holds for Kenyans. And we can't thank you enough for realizing that health is one very critical thing you'll have for your people above anything else. And I finish, Your Excellency, they say that when you want to kill a dog, you give it a bad name. We had a famous or infamous, I don't want to call it a project, it's more or less an arrangement that was not well, it did not have a lot of consultation, called the MES, which we dubbed as MES, senators know, which we later said it was a necessary evil because it is equipment we're used to at the moment. We are aware they may not be being conceived with a lot of consultation, but they are there with us and we can't do without them. Even as you put this together, Your Excellency, we ask you kindly to find it within your heart not to abandon counties in this very hour of need, because they may not be able to afford the MES at the moment. Please just give it another name and roll it out to the counties so that we can save their lives. Thank you very much, and may God bless you, sir.
Thank you, Excellency. Now I would like to make a few remarks. Your Excellency, when you gave me the responsibility to take charge of the ministry and ensure that we implement universal health coverage, let me disclose that for a minute I felt a little bit inadequate, despite having the health background. But I want to thank you, because besides me as your advisor, you also have your advisors in the Economic Council. And the secret of our success today, Your Excellency, is that I sat with your advisors in the Economic Council, and I told them, you know very well, I am the advisor to the President. Therefore, we can only make a team. Your Excellency, Dr. Mwai has made great contribution. Your Excellency, Dr. Turanira has made a big contribution. Your Excellency, Dr. Leah has made a big contribution. Those are members who are your advisors in the Economic Council, but I made them and turned them into my own advisors, and we have been working as a team to deliver on the responsibility that you gave us. Your Excellency, when we sat down and we agreed that for us to deliver universal health coverage, we must learn from the past mistakes and see what is it that we need to do as a ministry to ensure that this time round it does not fail as per your instructions. Your Excellency, we came up with 4 main pillars. The pillar on human resource for health. And we have been working together with all stakeholders. And today I'm happy to see that all stakeholders, or majority of them, are represented here. Dr. Davji, karibu sana, and let's work together. Your Excellency, we are in discussion, and in Kapkatet yesterday, we made a health workforce Kericho declaration. And one of the things that we agreed, Your Excellency, is that in the next 24 months, we are going to have a harmonious working relationship with all the unions, so that we ensure that we deliver on universal health coverage. We have many other issues or clauses in the declaration, and we have given ourselves timelines, because each one of them must be achieved. The second pillar of universal health coverage is on health commodity security. We have made tremendous efforts towards progressing that. While we began with ensuring that we reform Kenya Medical Supplies Authority, and I can confirm to you, the board that we have, the leadership that we have is now on track. And last week on Friday, you yourself witnessed what the team has been able to do. Your Excellency, when we came into office, the fill rate for orders that have been requested by the county governments was at 40%. As we speak today, Your Excellency, I have received feedback from many counties that we are now headed to 70%. And that is how we are working, Your Excellency. We are focusing on local manufacturing. We have brought all of them together, and we are working together to ensure that we achieve that you have given us to achieve. Your Excellency, the third pillar was on technology, that we ensure we leverage on technology to provide health care or health services to Kenyans. We have worked very hard. I must acknowledge that that was one of the most difficult pillars, but we have made a headway. That we now are sure that we are going to create a superhighway where all facilities can connect into and be able to provide services. But Your Excellency, the most important bit about the digital bill that we will be signing, that you have ascended today, is that now as a country and as a sector, we can collect real-time data and use that data to make effective decisions that affect the health of this country. And Your Excellency, again importantly, that now we are going to network facilities into a primary care network using the digital technology that has been provided. We have worked very well with support from my colleague, CS Owalo, who has ensured that infrastructure has been laid in facilities, and we are now on the second layer of ensuring that we operationalize those facilities, Your Excellency. The fourth and last pillar, Your Excellency, is the one on on health financing. We have made a lot of progress. And today, signing of these bills, the social health bill, Your Excellency, as a woman, as a mother, as somebody with health information or who has been in the sector, this is the day that the doctors say that the mother who is pregnant is quickening. We have started now kicking as a ministry because we know that with the social health bill that you have now ascended into law, we are going to move forward, Your Excellency, because there are 3 funds that we have created in there. The primary health care fund to ensure that the primary level is publicly financed. The social health fund, Your Excellency, for many years, and many Kenyans have given us feedback that they were not able to know what is it that they are covered for. Despite paying 500 shillings, they did not know what their benefit is. We have worked with the team, Your Excellency. Now we are clear on what is the benefit as soon as you make your payment. What is it that you are entitled to? Your Excellency, we have removed exclusions. We have removed limitations that now Kenyans will be able to access services and we shall not be able to leave anyone behind. Your Excellency, we are working very hard at the ministry. As the person in charge of the orchestra, I must acknowledge that the team has been working well. There are some strings that need a light touch and they give you the melody that you want. There are some strings that need a heavy touch and still they'll give you the melody that you want. But what you see today, Your Excellency, is a culmination of the efforts of the people at the ministry. And whoever has been on this thing up to midnight was one legal state counsel of the ministry, Terry Rotich. Your Excellency, she guarded these bills as though she was guarding a presidential vote up to midnight. I remember very well, it was 23:45. She sent me and she said, Madam CS, here they are, no comma change, no full stop change. Thank you very much, Terry. Your Excellency, we shall continue to produce the melody that you have asked us to produce to ensure that this country achieves universal health coverage. Today we have laid the foundation stone, and I am sure, I'm persuaded as a Christian, we have laid it on the solid rock. We are going to move, Your Excellency. We have had a very good week in Kapkatet. We have demonstrated to Kenyans that we are ready to go. And today I'm happy that now all our decisions are anchored on a law. We have already started working on the regulations. We are going to involve all stakeholders. And in the next 2 months maximum, Your Excellency, the regulations are going to be ready. Now, with those many remarks, I would like to invite His Excellency, the Deputy President, to make his remarks. Thank you, Your Excellency.
Your Excellency, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, the Honorable Speakers of the 2 Houses, Cabinet Secretaries present, and all stakeholders, good afternoon. Your Excellency, I didn't think I needed to say anything because you speak on our behalf, but let me take this opportunity because I'm here to salute the members of the National Assembly and the Senate for the expeditious manner in which they handled these bills that you have today assented into law. Your Excellency, we continue to applaud the 2 Houses of Parliament for the support they are giving to your administration's legislative agenda. Your Excellency, what now your assent means is that we who work under you have everything to do to implement these laws in turning around healthcare architecture for the benefit of the people of Kenya. But I would like also to take this opportunity to say, much as Parliament has worked very hard, the CS of Health and her team have worked very hard. Your Excellency, your personal leadership in this matter has been very momentous. For the last 1 year, you have chaired countless meetings that gave birth to these bills that you have today ascended into law. You have been very keen and categorical that a healthy nation gives way to a prosperous nation. So the journey that we have started today with the ascending of the bills will turn around the healthcare architecture for the benefit of the people of Kenya. And Your Excellency, I want to confirm that I've been around the country, and since your launch of the community health promoters with 100,000 kits, the impact of that intervention, Your Excellency, is already being felt on the ground. And the focus on preventive medicine as opposed to curative medicine will ultimately save this country on the health bill. There is data and research has shown that the cost of curing a disease is 9 times the cost of preventing one. So therefore, Your Excellency, this intervention in another 4 or 5 years will also bring down the cost of the health bill. Let me also take this opportunity to thank the county governors and their county governments for the way they continue to work closely with the national government, health being a devolved function, and I have no doubt in my mind that this collaboration will continue so that these laws can have an impact for the people of Kenya. Finally, Your Excellency, let me also commend Susan Nakumisha, the CS Health, and our 2 PSCs for the leadership they have exhibited in the health space. Susan Nakumisha is committed, she is focused, she has passion and zeal. And I have no doubt in my mind that working with our team, the bills that you have assented today in law will be implemented, and the people of Kenya will get to feel the benefit in not very too far a distance from now. With those very many remarks, it's now my honor and privilege to invite the President of the Republic of Kenya to address the nation by making his remarks. Mr. President.
Thank you very much. Let's take seats. Asante sana. Mr. Deputy President, Speaker of the National Assembly, Speaker of Senate, Your Excellencies, Governors, Ministers present, Principal Secretaries, Development Partners, Community Health Promoters, doctors who are here, medical personnel represented in this function. Ladies and gentlemen, good afternoon. Hamjambo. First, where we are today is not the achievement of a single person. Very many people have made sacrifices, huge contributions. They have gone out of their way to get us to where we are today. And in a very particular way, let me say that the people of Kenya spoke loudly, unequivocally about their desire for a system or a medical system that leaves nobody behind, where families do not lose their property or their savings because of illness. And I want to say I'm a very proud Kenyan today that working with many people, and they have, many of them have stood here, Turanira there, Mwai, Lea, those people, they have worked with me for the last 2 years, we put this thing together for the campaign. We didn't know that we were going to have it for the laws of Kenya. And they have patiently worked with me, as Susan confessed, in many boardrooms in this building. Before the elections, they worked with me in another place. And then after the elections, they worked with me here. The members of medical fraternity working at the Ministry of Health. Kwanza tuwapigie hawa watu makofi jameni. I even tried to appoint some of them into some positions. They told me, no, we must deliver this thing first. And that's the kind of commitment that my team of advisors have. Let me also congratulate the leadership of Parliament. I mean, in record time, Parliament discharged its responsibility. And two things happened. We chose first that as we developed the laws at the final stages, we invited the two committees, at least the leadership, to participate with us so that they could bring their insights, they could bring their advice on board, so that by the time we finished the pieces of legislation, Parliament understood where we were going. That was step one. Step two, I also want to congratulate the creativity of Parliament. That on the bills that started at the Senate, members of the National Assembly who still thought they needed to be fine-tuned, gave the amendments they wanted to their colleagues in the Senate. And those in the Senate gave their colleagues in the National Assembly whatever amendments they thought would improve the quality of these pieces of legislation. Again, that demonstrated patriotism, creativity, innovation in how we discharge our responsibilities as Kenyans, but much more specifically, the creativity of our Parliament. Congratulations, members of Parliament. Wacha niwaulize wabunge wetu wakiongozwa na leader of majority wa Senate na National Assembly. Tafadhali msimame tuwapigie makofi jameni. Thank you very much. Through you to your colleagues in Parliament, the people of Kenya appreciate the kind of sacrifice and commitment and input you have made. I cannot forget the two speakers for their wisdom. Both these two gentlemen are great leaders. Thank you very much. I know we spoke often on what needed to happen, and they provided guidance together with the clerks of our National Assembly, Njoroge and Nyegenye. I want to say thank you very much, gentlemen. Your contribution is immense, and we don't take it for granted. To our Council of Governors, we want to say we are truly grateful for your partnership. I did commit to our county governments that this administration will not undermine our county governments, and that this administration supports fully county governments in the discharge of their responsibility on health and their mandate on health. and that we are going to work together to make sure that counties succeed. Because when counties succeed, Kenya succeeds. And I want to say we congratulate you for your input, as always. And the encouragement that we've gone through this together. And I want to give you my assurance, Chair, my friend Onesimus Muthomi Njuki. I want to give you my assurance that we will not let counties down, especially on the subject of health, because by letting counties down, we will be letting Kenya down, and that we will not do. As you have said correctly, there will be a follow-through with regulations that will underpin some of the specific items of these pieces of legislation. A lot of work has gone into the development of regulations. We will now take them through the processes, making sure that the public have a say, making sure that all the other stakeholders are brought on board, so that we can have the chance to implement universal health coverage this time round and succeed. It is the one thing that we must get right. Because Kenyans collectively aspired for quality, affordable, and accessible healthcare system. Not for a short time. We've been here for a very long time. Speaker Wetangula will remember in 2012 with President Kibaki we tried, but we didn't quite get it where we wanted. We tried again in 2017, 2018, but the trials that went in Nyeri, Isiolo, Kisumu, and one more county, there were 4 counties, and Machakos. You remember they failed. The whole thing collapsed. And it was because it needed some thorough thinking. And that is why this time round we decided to create a firmer base based on legislation. And therefore, since independence, significant efforts have been made. But we have never quite gotten where we've always wanted. But that is changing today. We have reached a pivotal moment in our quest to reshape our healthcare delivery system. Today, 4 crucial bills for the implementation of universal healthcare have become law. These laws, together with various policies, strategies, and regulations that will be subsequently implemented, including the community health policy and primary health care and health financing strategies, will lay the firm foundation for the biggest change in our healthcare system ever witnessed. In the Kenya Kwanza Manifesto, we committed to achieving universal health coverage using various instruments. Number 1, we said there must be a fully financed primary health care mechanism comprising preventive, promotive, curative, palliative, and rehabilitative services. We also undertook that there will be integration of ICT into our healthcare ecosystem to enhance telemedicine, health management information systems, mobile health, and especially the portability of health records, as was explained here by Muthomi Njuki. when he said that health records are in all manner of shapes. They are in pieces of paper, exercise books, foolscaps, and all manner of paper. But now, with the laws that we have passed, you just need to identify yourself, and the doctor can pull out your health records, diagnose, know what kind of medicine you've had before, know what kind of condition you've suffered from before, and be able to assist you going forward. This opportunity also, we said, we must ring-fence healthcare funds using facility improvement legislation. And that is the legislation, the F5 legislation we've signed today into law. Both for national government hospitals that are referral and even for all the other hospitals down to the village. This is to protect money that we collect from healthcare facilities, not being used to construct pavements or gates or other pieces of infrastructure, but so that there is adequate resources to make sure that there is replenishment of health commodities, there is improvement of health facilities, and that we enhance the quality of delivery of our health systems. We also undertook that we were setting up an emergency medical treatment fund to cater for emergency cancer treatment, referrals, and other chronic ailments. We all know that many Kenyans become destitute because a member of their family had cancer, or they got an accident, or they were in an emergency. We have seen situations where there is an accident or there is an emergency, somebody goes to hospital, and they are turned away from hospital because they don't have a health card, they don't have someone to sign for them. This will be a thing of the past when we pass these laws. Providing National Hospital Insurance Fund coverage for all Kenyans was one of our undertaking. And we said this time round, it must not have exclusions. And it must cover everybody. Nobody should be left behind. Many Kenyans have asked me often, okay, we want to reduce from 500 to 300. Many Kenyans have asked me, what happens to the person who cannot afford 300? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover, so that we can truly say no Kenyan will be left behind. And of course, to strengthen our human capital resources so that we can deliver on this whole universal health coverage endeavor. The enactment of these laws, the Primary Health Care Act 2023, the Digital Health Act 2023, the Facility Improvement Financing Act 2023, and the new Social Health Insurance Act 2023 provide a legal and institutional framework for a new dawn in our healthcare system. With health insurance coverage at a low of only 26% nationally, out-of-pocket costs are decimating families and keeping sick people away from treatment. The new Social Health Insurance Act will now address financial barriers to healthcare and the existing challenges faced by NHIF by establishing the Social Health Authority. This law will repeal the current National Hospital Insurance Fund Act and establish 3 new funds as follows: the Primary Health Care Fund, the Social Health Care Fund, the Emergency, Chronic and Critical Illness Fund. These funds will ensure public-funded primary health care, emergency care, and universal health insurance, while also promoting equitable access to quality health services. The Primary Health Care Fund will finance services from health facilities at level 1 to level 3, while the Social Health Insurance Fund will cover services at levels 4 to 6. The Emergency, Chronic, and Critical Illness Fund will fund emergency and chronic illness costs once social health insurance is depleted. This fulfills the express wishes of Article 43(2) of the Constitution, which provides that no Kenyan should be denied emergency medical services. As you're all aware, this has not been the case so far. The Primary Health Care Act addresses the current health imbalance in Kenya by emphasizing preventive and promotive health services. The Act introduces a framework for the effective delivery of primary health services through networks that include all healthcare providers, whether they are public, whether they are private, or even faith-based. Kenyans have voiced their desire for change in healthcare, highlighting high costs and limited access to curative services. In response, we are committed to a community health approach that emphasizes prevention and promotion. Less than a month ago, we flagged off the kits that over 100,000 community health promoters will use in our counties. Tomorrow, during the Mashujaa Day celebration, we shall unveil these promoters and deploy them countrywide. Each community health promoter will be responsible for 100 households, and they will have kits and phones to enable them work effectively, efficiently, and in an accountable manner. The national and county governments will share the responsibility of stipends for the promoters, and our goal is to bring healthcare directly to Kenyans' doorsteps, significantly improving accessibility and affordability. The Facility Improvement Fund Act will counter the decrease in funding for public health facilities which often lack the requisite levels of investment, leading to a lack of autonomy, fragmented services, and poor outcomes. This law will entrench financial and managerial autonomy to enhance decision-making, efficiency, and community involvement in the management of facilities. While some counties have attempted to ring-fence health funds, only 26 out of 47 have succeeded. The Act provides guidelines to ensure a unified approach to facility autonomy, enabling them to independently retain and manage funds, ultimately improving resource availability, quality of services, and also enhance efficiency in the delivery of health. The Digital Health Act will streamline the adoption of technology in the health sector, enabling improved data sharing and resource utilization. This law will address the existing legal and regulatory gaps in the framework for e-health ecosystem and its data life cycle, enabling the development of standards for the provision of mobile health, telemedicine, and e-learning in matters around healthcare. It has the potential to personalize patient care, improve quality, and empower communities. Our national healthcare journey has been long and at times painful. Indeed, most Kenyans have always insisted healthcare is the public service that they want the most. It is their number one priority. Today, we have made a significant step towards making
healthcare universal for all Kenyans. I thank and commend the people of Kenya for actively shaping these laws through various public engagement platforms. I also thank, as I have said, the Council of Governors, county governments, development partners, and there are many. I know this event was convened at short notice. There are many development partners who have come through and supported us in this endeavor. And of course, the National Assembly, the Senate, our collective body of parliament for doing a fine job. These laws will transform healthcare in Kenya. They will save lives, empower communities, and make us a stronger and a healthier nation. Congratulations to everybody. We will be seeing up the community health promoters tomorrow. I wish you well. Asanteni sana. God bless you. Na tuonane kesho. Thank you.
Your Excellency, sir, with your permission, I'd like to request for a few photo opportunities. And with your permission, let me invite His Excellency, the Deputy President.
Thank you, Waziri. Your Excellency, the President, Deputy President, all protocols observed. Your Excellency, the President, I'm honored this afternoon to join you in the assent of those 4 health-related bills. Your Excellency, you will recall that during the campaigns last year and in the run-up to the campaigns, you did promise the people of Kenya radical changes in our healthcare architecture of the country to actualize the universal health coverage dream that has faltered in the governance of our country over the last close to 15 or so years. Your Excellency, your assent to these 4 bills today makes that dream become a reality in the very near future. And we look forward to the implementation of these bills by the Ministry of Health and all the stakeholders that will be involved in the implementation of the 4 bills. Your Excellency, the radical changes in our healthcare architecture will see not just the realization of universal healthcare coverage for millions of our people, but you bring to an end the rendering to destitution of millions or hundreds of thousands of families across the length and breadth of the country, families that have been rendered homeless. Others, Your Excellency, have lost many of their assets on account of healthcare bills. The Social Health Insurance Fund Bill, Your Excellency, will in a big way transform the social health insurance subsector of our country and assure Kenyans that they shall no longer have to lose their homes, they shall no longer be rendered homeless or become destitute in their own country on account of healthcare bills that they have incurred in hospitals. Your Excellency, the Digital Health Bill leverages in a great way on how we leverage on technology to improve the efficient and effective provision of healthcare services from the far-flung corners of our country to the level 5, level 6 referral hospitals in our country. It will be possible now, Your Excellency, in due time for Kenyans to be able to have a CT scan in Elwak and have a medical consultant in Kenyatta National Hospital or Nairobi Hospital review that CT scan and be able to advise the healthcare professional back at a health center in Elwak on how to treat their patients. It is this revolutionary interventions, Your Excellency, through a very participative process that began with the Ministry of Health, and I must commend the Ministry of Health for the very detailed and participatory approach they began almost a year ago when your administration came into power. To date, Honorable, Your Excellency, my apologies, I'm used to addressing the Honorable Speaker. Your Excellency, culminating to the assent of these 4 bills today. That participatory approach, Your Excellency, culminated in what has also now anchored a new way of working between the 2 houses of Parliament, and I'm glad to inform Your Excellency that the bicameral Parliament has worked very well together, both houses, the Senate and the National Assembly. And we saw the passage of these bills in both houses. The bills that originated from the National Assembly were passed in the Senate without a single amendment, and those that emanated from the Senate were passed in the National Assembly without a single amendment, through a process where the 2 houses, both committees of health in the 2 houses, were able to consult ahead of the passage of the bills and agreed on the nature and manner of amendments that they wanted passed, and they were done in each house. And Your Excellency, I believe this also lays a very firm foundation on better working systems and processes of the bicameral Parliament in our country. With those few remarks, Your Excellency, congratulations, and I do hope, Your Excellency, that you shall lead your administration in actualizing this dream of universal health coverage to the people of Kenya. Thank you, Your Excellency.
Your Excellency, permit me now to call the Leader of Majority from the Senate. I'm told he's not around. He'll be represented by the Chief Whip.
Mr. President, sir, all protocols established, it is my pleasure on behalf of the Senate, elected and nominated members of Parliament, to bring their greetings and to bring their congratulations to the President and all the stakeholders, including the families back home that will be partaking of this bill. Your Excellency, allow me, as I congratulate you, to also pass my congratulations to the leader of the minority in the Senate, because on this series of bills, it is an area where